Hello everyone, and I hope everybody is doing perfectly fine. So now in my subsequent lectures, I'll be starting with neoplasia. And so today I'll just give you a very brief introduction about the chapter, what we'll be studying. And today we'll be discussing only the basic thing, that is how you define neoplasia. It's a very important chapter in general pathology, I say. And it is actually, when you start reading it, it is tough. But what I feel is one, two to three readings of Robbins or any book which you follow, you give it, it becomes much easier and you actually enjoy reading the chapter. So in general pathology, actually, I must say that well, I have no regret in saying that this is the best chapter which I like in general pathology. So first, let me start with what is definition. So how you define neoplasia. So basically, it is what? It is an abnormal mass of tissue. Obviously, जिसको हम cancerous growth कहते हैं वो क्या होता है? So this is abnormal mass, जो normal. So it is an abnormal collection of tissue, correct? Which is growing at an exceeding fast rate. So growth of which exceeds and is uncoordinated with that of the normal tissue. Suppose a normal skin, how it should develop, it is developing as a mass, uncontrolled mass at a faster rate. And it is persisting in the same excessive manner even after the cessation of stimuli which evoke the changes is removed. Suppose once a patient is taking tobacco, ठीक है, tobacco chewer है, तो उसको squamous cell carcinoma हो गया टंग का, ठीक है, gradually. So even if he has stopped the tobacco chewing, then he will, that mass जो एक टंग में develop हो चुका है, so that will continue developing. So even after the stimuli which evoke the chemical changes जो molecular level पे change कर रहे थे, so that stimulus, even if you remove it, but once the change has started, so it will continue with it. So that is how you define it. It is an abnormal mass of tissue, growth of which exceeds and is uncoordinated with that of the normal tissue. And even if you remove the stimuli, the growth will persist in the same excessive manner which evoke the changes. So benign or malignant hota hai. Cancerous, non-cancerous you can say. So benign is your non-malignant, not cancer. So वो कैसे, जब है तो ये भी ट्यूमर ही, benign ट्यूमर होता है, malignant ट्यूमर होता है. So benign tumors जो होते हैं, आपको main, you should know that under four headings you can describe it. You can describe the gross of the tumor, you can describe the microscopic feature, then third you can describe the rate of the tumor, rate of the growth, then you can say how it locally invasion, and then you can describe the metastasis. So फर्स्ट विल गो फॉर द ग्रॉस ऑफ द बिनाइन ट्यूमर्स. सो बिनाइन जब हम बोलते हैं ना, वो बहुत ही साफ सुथरा ट्यूमर यू कैन से. सो इट इज वेल सर्कमस्क्राइब्ड, इट हैज अ कैप्सूल, सो नो इन्वेजन यू कैन से. देन इट जस्ट compresses the surrounding tissue. It does not destroy the adjacent tissues. Then it is usually small in size and you will see it has less secondary changes like necrosis, hemorrhage. ये सारी चीजें malignant tumors में ज़्यादा होती हैं. Then when we come to the microscopic feature, ठीक है, so it will resemble your present tissue, the parent tissue. जैसे अगर suppose it is a skin of liver, so when it is a benign tumor, so you will see the hepatocytes which are arranged. So it is the normal parent tissue का architecture is maintained when it is a benign tumor. Then polarity is maintained. The cells आप देखते हो ना, orderly arranged होते हैं cells. So those cells that is कि polarity maintained रहती है. तो benign tumors की polarity maintained रहती है. Then NC ratio, the nucleocytoplasmic ratio is normal in benign. There is no difference in size of the nucleus. That is, anisonucleosis is not seen. Then there is no hyperchromasia. The nucleus does not appear dark, and mitosis is usually absent. So when you see the rate of growth, third point है हमारा, the rate of growth of benign tumor is very slow. अगर कोई fibroadenoma breast है female को, the rate of growth will be very slow. Then it is usually slow and progressive, and it may stop also and it can regress also, depends. देन फोर्थ इज लोकल इन्वेजन. तो जो बिनाइन ट्यूमर होते हैं वो लोकली, ऑब्वियसली कोई भी ट्यूमर अगर बड़ा होगा धीरे धीरे, बिनाइन ही है, बट इट विल कंप्रेस योर एडजेसेंट स्ट्रक्चर. तो अगर सपोज यहाँ इफ अ पर्सन इज हैविंग अ ट्यूमर इन नेक, तो बिनाइन ट्यूमर भी है तो इट विल कंप्रेस द एडजेसेंट टिश्यू, सो दैट कैन क्रिएट सम काइंड ऑफ सिम्टम और साइंस इन द पेशेंट. मेटास्टेसिस इज एब्सेंट इन बिनाइन ट्यूमर्स. Then coming to your malignant, same gross में क्या देखोगे आप कि irregular, poorly circumscribed tumor है, surrounding tissues are invaded, then it is larger in size and secondary changes are more frequently seen like your hemorrhage, necrosis, all cystic degeneration. So all those changes are more often noted in the gross specimen of malignant tumors. Then microscopy, when you see it, so microscopy में हम क्या देखते हैं? It is less resembling to the parent tissue. So अगर liver का cancer है तो you will not see normal hepatocytes in the liver, histology of the liver when you see the tumor. So it will be like not resembling to the hepatocytes, it will resemble very pleomorphic form में, ठीक है? So polarity is lost. So there is no orderly arrangements of the cells in the tumor. So there is pleomorphism is obviously present. The cells will be of different size and shape. Nucleus cytoplasmic ratio will be increased. Nucleus increases in size, correct? Then anisonucleus, so there is variation in the size and shape of the nucleus. Then hyperchromasia is present. It is dark, like hyperchromatic cells you will see. Mitosis is present, and that too the mitotic figures will be atypical also, tripolar, all those atypical and abnormal mitotic figures will be noted. And then we come to the rate of growth. It is rapid. And local invasion also, when you see जब benign जो था वो push करता था, ये क्या करता है ना, infiltrate करता है adjacent tissues को, invades and infiltrate the adjacent tissue. Then fifth one is your METs. METs is the key feature of your malignant tumor. So metastasis होती है. Suppose अगर liver का cancer है, can go to other organ also. Bone को affect कर सकता है, lung को जा सकता है, brain में जा सकता है. So anywhere that tumor can go. So that is metastasizing. So these, what I wanted to highlight is when we read neoplasia, when we are starting the neoplasia chapter, we should know what is basically neoplasia. So neoplasia का definition we should know, and then we'll come to the benign and malignant difference. So difference we can read in under 5 heading. First you can note down the gross features of benign and malignant tumors, microscopic features of benign and malignant tumors, rate of growth of benign and malignant, then how locally invasion is done, and how metastasis. So metastasis is seen in your malignant. So these 5 headings are there. You can easily differentiate benign and malignant. So thank you so much for your patient hearing. Kindly like, subscribe and share my YouTube channel Patho with MK. Looking forward. Thank you so much.